I mean, this is definitely the sickest I've been in my adult life.
Well, new tonight at 6, beating the coronavirus. A local professor now sharing her emotional story on how it impacted her life. Well, Dr. Noelle Lefforge is a clinical psychologist and a UNLV professor. And 13 Action News anchor Jackie Kostick spoke with her via Skype today, and she shares her message tonight.
As somebody who's relatively healthy, the fact that it hit me so hard and I got so sick from it, it makes it unimaginable to me to be somebody who's in a more vulnerable health position.
Noelle Lefforge is on the other side of COVID-19. The 39-year-old says she likely contracted the virus while attending work conferences in New York and D.C. in late February into early March.
Everyone was relatively careful at the conference, right? Like, I was washing my hands way more than I've ever washed them before. Like, we knew enough at that point that everyone was taking precautions.
Even with proper precautions, Lefforge says the day after returning home, she started feeling sick.
You know, it still didn't seem likely at that point that it was the coronavirus.
That was until people she'd come in contact with began testing positive.
There was a listserv for the conference I was at in New York, and people started posting, I have it, I tested positive. So, to know that I had still gotten sick, even though I was more cautious health-wise than I've ever been, it was like, man, this stuff can spread.
For more than a week, Lefforge's symptoms varied from fever, fatigue, and muscle aches and pains to digestive issues, loss of appetite, and loss of smell. 9 days in, she says she took a turn for the worse.
Scariest it got was that Friday morning. That was March 20th. And I don't know, talking to my husband, he was just like, you're not good. My voice was weak. I felt super shaky, but I still just couldn't manage to eat really. I just wanted to sleep.
Her husband took her to the Faculty Treatment Center at UNLV, where she saw firsthand what doctors and nurses needed to provide care during this pandemic.
You know, in order for anybody to see me, they had to have on a full apron cover. They had to have on a mask. They had to have on a face shield.
Understanding just how contagious this disease is and how severe it can be, Lefforge says she hopes everyone takes this seriously.
I mean, even being with all the privileges that I have, kind of scared to go in to see a healthcare provider and seeing how few resources they had. Even to treat me in my case wasn't one of these severe cases. I think that that's terrifying. And if we want to leave the capacity for the people who need it the most, everyone has to take this incredibly seriously.
Lefforge was quarantined for 14 days along with her husband and 2 children. And although she's thankful her family hasn't shown symptoms, she says she still worries.
How many people did I expose during that time that I just didn't know any better? And, I hope that at this point we know enough that I didn't know any better can be taken off the table.